Why does wheezing disrupt sleep in COPD patients? Have you ever wondered why some people with chronic obstructive pulmonary disease experience sleep disruptions due to wheezing sounds? Let's take a closer look at this important topic. Wheezing is a common symptom of chronic obstructive pulmonary disease, often indicating that the airways are obstructed. This obstruction makes it hard for air to flow freely, especially during sleep. When a person with chronic obstructive pulmonary disease sleeps, their body naturally relaxes. This relaxation reduces the muscle tone that keeps the airways open. As a result, the airways can narrow even more, leading to increased resistance when breathing. This is when wheezing sounds often occur. The sound itself is a sign that air is struggling to pass through these constricted passages. Another factor is that during sleep, many people with chronic obstructive pulmonary disease experience hypoventilation. This means they do not breathe as effectively, which can lower oxygen levels in the blood. When oxygen levels drop, the body responds by trying to breathe harder, which can lead to more wheezing. Higher carbon dioxide levels can also build up, worsening the breathing difficulties. These wheezing sounds can interrupt sleep by causing frequent awakenings. When a person wakes up due to difficulty breathing, it can lead to fragmented sleep. This means they may have trouble falling back asleep, resulting in poor quality rest. In addition to wheezing, other symptoms of chronic obstructive pulmonary disease, such as coughing and sputum production, can further disturb sleep. Anxiety and depression, which are common among those with chronic obstructive pulmonary disease, can also contribute to sleep problems. Some medications used to treat chronic obstructive pulmonary disease may affect sleep quality as well. Overall, wheezing disrupts sleep in patients with chronic obstructive pulmonary disease because it signals that the airways are obstructed. The combination of reduced muscle tone, airway narrowing, and impaired breathing control during sleep leads to increased wheezing. This results in breathing difficulties, lower oxygen levels, and frequent awakenings, all of which make it hard to enjoy restful sleep. Addressing wheezing and managing airway obstruction is essential for improving sleep quality and overall well-being in individuals with chronic obstructive pulmonary disease.